that I'll be asking the panelists. I'll be going over those 4 questions. And then after that, we will open it up to students to ask some of their specific questions. Also, please know that this event is being recorded. I just pressed record on the Zoom. And so just wanted to let everyone know we'll be recording this so it can be shared out to other BSW, MSW students that were not able to join us today. I also want to note that there is a handful of Salt Lake Community College students also joining us today. So thank you for being here and showing your interest in the College of Social Work and its events. And we're excited to have you be a part of this. So first to start, I'm going to ask our panelists to give us their name, their pronouns, and their current role that they're in and where they're currently working. And so if Joanna, if you would be willing to start, that would be wonderful.
Yes, thank you. My name is Joanna Chavez. My pronouns are she, her, hers. And I am a therapist, part of the behavioral team for community health centers in the Salt Lake Valley.
Great, thanks, Joanna. We'll go on to Robert, who's joining us from Arizona, actually.
Hey everyone, my name is Robert Lambert. My pronouns are he, him, his. I currently work as a therapist at a community health center, but I think for this conversation, about 2 months ago, I left a job where I worked at Mayo Clinic Hospital as an inpatient social worker for 2 years. But right now I'm pursuing my LCSW, and the hospital environment did not support clinical supervision. So, and that's why I left.
Great. Thanks, Robert. Let's go to Amberly next.
Can you hear me okay?
Yep, we can hear you.
Okay. So I'm Amberly Reed. My gender pronouns are she, her, hers. I am currently the manager over the crisis teams in Salt Lake County for Intermountain Healthcare. So LDS, IMC, and telecrisis. And then I also manage the inpatient unit here. And what led me to this? Are we going into that? I'm sorry.
No, not yet. We'll get there though. But yeah, thank you. That was perfect.
Yeah, you're welcome.
Thanks, Amberly. And then Timothy, if you want to give us your name, pronouns, and current role.
Hi, I'm Tim Champlin. My pronouns are him, his, her, or he, him, his. Yeah. I currently work for Valley Behavioral Health in the Salt Lake area. And I work at a clinic in West Valley where I do therapy, and also am an attending clinician role where I work with the rest of the therapy team and provide supervision and support for them.
Great, thank you. And then if you are all just joining us, please make sure to mute your microphone so that our panelists are the only ones that can speak and be heard, just so that there isn't any background noise. So thank you. All right, we're gonna move right into some of the questions for our panelists. So what led you to focus in on medical social work when you were a student? And also, if you wouldn't mind just giving us a little background on your education, that would be really helpful, just like where you went to school, what your bachelor's and master's were in, and then just what led you to kind of focus in on like the medical or clinical side of social work. I'll just start with Robert, if that's okay, and then we'll popcorn from there.
Sure, yeah. So I lived in Salt Lake for over 10 years. I got my bachelor's in sociology. And I was like, I don't know if I really want to do something in sociology quite. So I got really interested in psychology, and I was actually going to get my PsyD. And then for my own personal experience, I had some interaction with the medical team at Intermountain Healthcare. And I met actually some case managers, a medical social worker, and some case coordinators that kind of led me down this path. The help that I received myself kind of encouraged me to do medical social work. So I went on to move down to Phoenix, and I got my MSW here. And then I actually moved back to Salt Lake for a little bit. And then I got my, I think they call it CSW. I took my licensure, and then I got a job offer where I interned when I was getting my MSW at ASU at Mayo Clinic. I got a job offer there, so I moved back down here.
Great. And then can you tell us a little bit, was there any specific thing that led to you really wanting to choose the medical side or clinical side specifically?
It was, yeah, just on my personal, medical journey that I had interactions with these type of people. It was very exciting to me. They helped me a lot, The doctors, of course, helped me, but I think social workers are such a crucial part in the medical piece, and we're often overlooked. That just that impacts it. Like, that's something that I want to do, is that I want to be involved with kind of the psychosocial piece of medical care.
Excellent. Thank you. Thank you so much for sharing that, Robert. All right, let's move right along. Timothy, Tim, if you'd be willing to share a little bit about your bachelor's, your master's, and what led you to choose a focus within the medical clinical side of social work.
So my story kind of starts when I was a teenager. I met my best friend and got to know his family really well, and thought his dad was like so cool and awesome. And his dad was a therapist, and I remember like talking with him about it at that age, and being like, so you just like talk with people all day long and kind of help them navigate like their different life complexities. And it seemed so cool, and I was really drawn to that. And his one advice, he said, yeah, just make sure you get your MSW. And I was like, cool. I had no idea what that meant at the time. But so kind of since then, I consistently was interested in it. And I attended Utah Valley University down in Orem and got my bachelor's in social work. And then from there, I was able to get into the advanced standing program at the University of Utah. So I was at UVU for 6 years and at the U for just 1 year. Had a really great experience. Yeah, and I as I was kind of in school, I just became more and more passionate about social work, and just how I just felt like it was so exciting how it looks at all these, like, the big picture of people in their lives and everything that can be going on, and I love that kind of avenue of being able to work with people.
Excellent. Thank you so much for sharing that that personal component. That's so great. And I think that's so real for so many students to be led to social work through their personal relationships. So thank you for sharing that. Let's go right on into Amberly, if you're willing to share sort of a little bit about your educational background and why you chose medical social work.
Sure. So I started my bachelor's degree not going into social work, but hoping to do something with like the weather. I wanted to chase storms, and so I started to go down that path and quickly learned I am not a fan of school. So then I took a social work class, and I liked it because I connected to it, and I've always been I'm a people person, and so it was simple. And so from there, I transferred I was at Slick originally, and then I transferred up to the U and did the undergrad for social work, and took some time between getting my master's degree. I think about 2 years before I went to the master's program, and did the advanced standing as well. And after I graduated, I had always thought I wanted to do outpatient therapy. I'm sure like so many want to do, and it was not my cup of tea. I wouldn't have bet that for anything. So at that time I was PRN for uni at the University Neuropsychiatric Institute, and did admissions, just clinical crisis assessments. and I loved it. Loved the chaos, loved the speed. It was just exactly where I wanted to be. So I stayed there for 5 years, and then I came to Intermountain last summer. I don't know that I necessarily had something that drove me to medical social work per se. I think I just fell into it and really liked it. I like being able to have a patient for a limited amount of time and be able to hand them off to somebody else and move on to the next person. So that's kind of my story.
Great. Thank you so much for sharing that personal element as well. Very helpful. All right. And we'll just end this question with Joanna. If you would just tell us a little bit about your education and why you either fell into social work, medical social work, like so many, or if you really found a passion and pursued it. We'd love to hear about it.
Yeah, so I went to San Diego State University and graduated with my psychology or bachelor's in psychology in 2009. And then I kind of just worked my kind of wannabe therapy jobs and worked with a lot of kids on the autism spectrum until I realized I wanted to work with adults. Therefore, I had to go back to school. So I actually did the SUTSI program through the U, and I really enjoyed it. And that's kind of how I learned about the MSW program. So I signed up for that shortly after, and I got my MSW in 2018. So right now, well, this month I should be getting my L. Very excited. And so aside from that, that's kind of like my education background. When it comes to more of the medical aspect of social work, my first year in the MSW program, I had my practicum at the neurobehavioral home program at the U, and I really enjoyed the more comprehensive approach to medical care. Just that one place where patients can get their medical needs, mental casework, nutrition, all of these things. So with community health centers is not as comprehensive, but we do tackle the medical, mental, nutrition, and a little bit of case management. So yeah, it was mostly that, and I really liked working with the doctors. They're very respectful of my expertise, and I am of theirs. So it's been really a great experience with that.
Great. Thanks so much for sharing that perspective, Joanna. It's sounding like we have a variety of pathways that led our panelists into social work and then and medical social work or clinical specifically. Anything from, having this great touching point with communities, providing, comprehensive services and support, personal passions that really led you to this area. So it's really helpful, I think, for our social work students or even prospective students to hear that there's no one pathway into this field. There's a lot of different ways to approach it. And oftentimes, what I hear are panelists really being curious and talking to people and pursuing programs that were in alignment with their interests and their values. So that's really exciting to hear that you all kind of had your own way in. So we're going to move right along into the next question, which is, can you tell us a little bit about maybe the challenges and rewards of your current position? I think, we as folks that are understanding of the field of social work, there's a lot on our plates as social workers. You all have a lot going on. So I think it would be helpful to hear from you all in your individual roles. When is it those days when you really love your job and see the purpose and the impact you're having? And when are some of those other days when you feel it's a challenge and you have to push through? So I'll take this one over to Tim if he's willing to start us out here.
Okay, so I I'm guessing that there might be kind of like a similar theme with the other panelists in terms of rewards and challenges. So in my practice and what I do, it's so I'm in community mental health. The vast majority of my clientele are on Medicaid, and they also tend to maybe lack resources that other people may not as much. And I work with a very wide spectrum of clients with different diagnoses and different challenges and different things they're struggling with. So I think a challenge that I tend to face with my clients that maybe struggle with having resources, whether it's homelessness, whether it's not having access to an income or a job. It's kind of dealing with this feeling of not having very much control over what my clients deal with. They can come in or we can talk over the phone for an hour every couple weeks, and we can share some really good moments and talk about some tools or coping skills that might be helpful for them. But in the long run, I don't have as much influence as I would like over their lives. I would love to snap my fingers and help them to have all of a sudden they have supportive partners or families or whatever. But unfortunately, that's not the case all the time. On the other hand, the reward is when a client is able to feel really empowered and take control of their life. That is such a rewarding thing. And just as an example, I have a specific client where when I first started working with her, she was homeless. She was living in a tent in some trees. Just didn't have much support. And with working with case managers and a prescriber and some other helpful team members, she has her own apartment now. She has some medication that's very helpful for her. Her depression and anxiety have drastically gone down. And she's finally at a place where she's like, I can pursue what I want to in life, because so many of those obstacles have kind of gone away for right now. So that's definitely my favorite part of it. And just to see all these kind of, in my opinion, miraculous things that can happen with clients in their lives and with the support that they can have.
Awesome. Thank you so much for sharing that, Tim. It was really helpful to hear about, I think this feeling that a lot of social workers feel, which is just wanting more involvement, wanting to make a bit more of an impact, but also realizing that there are a lot of tools and skills that you're giving, your clients to help them move forward. And that empowering piece, I think, is so huge in what social workers in general do. But I think hearing that you work with prescribers and that you can help them, find housing and get the support they need is really helpful. That empowerment piece is huge. So thank you for sharing that. We will move right up.
I think you're muted, Anna.
Oh, sorry. I don't know why I did that. We'll move on to Amberly and ask her what some of the challenges and rewards are of your current role in medical social work. I know, Amberly, you're working in management, some leadership roles, so it'd be great to hear from you what your challenges and rewards are.
Sure. I wasn't sure which one you wanted because both are a can of worms. Challenges and rewards. So rewards for me are, as a manager, to me, it's so rewarding to to have a relationship with my employees and to know them and trust them and they trust me. And we're in this relationship that's, we're both benefiting from it. And I love that. I love getting to know them like that. And I think it's similar, even working with patients, it's a similar reward. When you have that moment, you feel like you really helped somebody and their family so grateful. Like those are why those help keep you going. Challenges with management are the same things that are, can be the reward. Working with multiple teams is a challenge. It's a challenge to get everyone on the same page and get everybody doing what's best for the patient from their point of view, not necessarily my point of view or the social work point of view. And healthcare has a lot of walls and tape, and it's learning to navigate in that system. It's very difficult. The thing that helps with those challenges are having a great manager myself. He's so supportive, and I feel like I can go to him with anything, and he listens and is helpful that way. So despite that challenge, I am blessed with him. So yeah, that's kind of it.
Great. Thanks, Amberly. It's really helpful to hear your perspective as a manager. And Amberly, you work with a lot of social workers that are pursuing medical social work. That's right.
Yeah.
And so they're all learning and growing when you're with them. And I think that's really great to hear.
Yeah. And I think the great thing about medical social work is the diversity you get. You work with so many different types of populations and illnesses and ages, and it's just such a fantastic starting point if you don't know what you want to do.
Oh, that's great. Perfect. Thank you so much for sharing that perspective. I think that's going to be really helpful to our students. All right, let's transition to Joanna, if you're willing to tell us a little bit about what you feel some of the challenges and rewards are of working in your role.
Yes, and I'm glad to say that when I was trying to think of this answer, I had a harder time coming up with the challenges than the rewards. So overall, I'd say for me, a challenge has been staying on top of the resources that are available that I can possibly provide to the people I work with, to the patients I work with. Another challenge at first was doing therapy in Spanish. I'm a native speaker, but the therapy lingo, some of it I was not familiar with. So now it's a lot better. And I'd say for the rewards, obviously for me being able to help the Hispanic community, there's a little bit of a stigma with Hispanics or is mental health is just not something that we necessarily seek help for. And some of the patients I've seen are older and they've been dealing with it for years. And this is one of the first times that they're getting some additional support and helping them maybe normalize the way they're feeling a little more. So yeah, and another great reward of my company, I guess specifically, is they got a great CEU program. So it's very exciting.
Can you tell us more about what that program is for folks that maybe aren't aware of what that means?
Oh yeah, so continued education. For my company, it's very nice. They give you a few $1,000s and paid time off, and then you can seek training. And my supervisor personally, he really prefers for us to go to the source, which means we get to do a little bit of traveling and going and getting training from the people themselves. Like I had the opportunity to go do the Gottman training 1 and 2. So that was exciting. Yeah.
Oh, awesome. That's great. Sounds like there's definitely a pattern of folks feeling supported in their jobs. Having good supervisors and managers can really make a difference in how you show up for your clients. Also, thank you, Joanna, for sharing your experience as a bilingual social worker and the challenges that have come up with that. I think that's a very unique perspective to hear. So yes, thank you for sharing those challenges and the rewards. And then we will just round things out with Robert. If you just want to tell us a little bit about some of what you feel are challenges and rewards of your role, whether it be your current one or previously working in the medical field, whatever you prefer.
Sure. Yeah, I'll talk about, as an inpatient social worker in a hospital, it's incredibly rewarding, but incredibly crazy sometimes. Um, so typically, Mayo was unique because we didn't have as many patients to look after that we were assigned to as other hospitals, from what my colleagues that came there told me. But even then, sometimes you would be assigned to 4 or 2, which would be up to 60 patients. So you are in charge of essentially 60 patients, and you're supposed to be the amazing social worker, miracle worker, supposed to solve all the problems of everyone. That being said, some of the challenges for me at first was it's case management heavy. So if you're working in an, inpatient hospital, and I only can speak for myself, it was a lot of case management stuff, not as much therapy. I still did it. I still did, short-term, kind of CBT breathing exercises, people that are in trauma at that point, but a lot of it was case management. The workload, like I said, is heavy. It's also a lot of turnover. So some people, I liked it. It was like, the average stay was probably, depending on what floor you're in, 3 to 4 days. So you maybe talk to each client one time, or the patient one time, and that's it. You had to do a psychosocial, you had to figure out their needs, and then they would leave, and then you would just go again, which was an incredible rush. It's incredibly, a lot of people love that, especially, if you're the type of person, I think that's up your alley, but you don't really get to, on the off side of that, you don't get to spend a lot of time with clients. And of course, there's a difference. So like outpatient medical social work, you typically get to spend more time with the clients, but specifically inpatient, you didn't really. Medical jargon, so like just reading doctor's notes, reading physical therapist notes, reading infectious disease notes. You're expected to understand them in order to anticipate their needs. So what is this patient going to leave with, and what will they need from a social work perspective? So that was very challenging at first, like trying to read, like I have no idea what half of these things mean. I have no idea what this doctor and this resident is saying to me. I'm just gonna nod and act like I do at first. But then, after a while, you get more and more used to it, and like I was very comfortable, and I loved it. I loved learning about medical stuff. I loved the action in a hospital. All that was really cool. Another positive thing, aside from being fast-paced, is it is working with a multidisciplinary team. So I was working with techs, I was working with bedside RNs, I was working with, very prestigious surgeons, I was working with residents, physical therapy, occupational therapy, dietitian, just like everyone. So it was really cool to go to rounds or to be involved with the continuity of care, because, they need us. Like the medical side more and more is realizing, I think, that they need that outside stuff. So they can kind of reduce the symptoms, a doctor can, all they want in the hospital. But if outside the psychosocial part, if they're not getting what they need, they can wind up back in the hospital. And that's where we come in, and it's extremely valuable and important in a hospital setting, I think. And then I guess the last thing is, typically I would say the pay and the benefits are a little bit better for an MSW just coming out of school than a typical social work job without your LCSW.
Perfect. Thank you so much, Robert. That was really helpful for you to talk specifically about what the environment is like as a social worker in a hospital setting like the Mayo Clinic, and hearing the differences between your experiences and other folks on the panels that are maybe more in the community center environment, and sort of hearing that, you're meeting with patients maybe once, and that there's a lot more heavy load. You're seeing a lot more people, but for less amount of time. But yeah, I think knowing the realities of that environment is super important for our students to hear, but also recognizing that our students, some may want that rush, and the opportunity to be on those multidisciplinary teams is so exciting to so many. It sounds like it's really different every day in some ways. So really cool to hear that that's an element of the environment that you experienced there. So thank you for sharing some of that, and for sharing the pieces about what it was like to get a job as an MSW in that field. All right. Excellent. So we're going to move right along and focus on our last question before we take questions from our students and our attendees today. The final question is, what is one piece of advice you would give a current student who is considering a career in this field in particular? Yes, social work, but maybe more so, whether it be specifically to your community health oriented social work, whether it be medical social work specifically, just sort of helping them, and maybe it's a piece of advice you got when you were sort of thinking about, maybe I'll do private practice, or maybe I'll go this route. What was a piece of advice that you could share with our current students that would help them maybe lean one way or the other further to pursuing this area? So I'm going to start with Joanna on this one, if that's okay, and then we'll move right along.
Yeah, I'd have to say that because we do work with other disciplines, for example, in the community health clinic that I work at, being confident in your knowledge and your expertise is going to come across as just really doctors are going to feel like they can trust you, and they'll send their patients to you, and which ultimately will encourage patients to seek support when it comes to mental health, make it more accessible for them. And I think ultimately that's what we all want. So yeah, just being confident and knowing that you've done your studying, you've done your work. Some of it you'll have to figure out on the spot, but that's okay.
Awesome. Yeah, that is great advice. And I appreciate your honesty there too. And that and kind of what Robert said too, you figure out a lot of this once you get into your roles and into your communities. You learn about the resources that are available, but that confidence piece is huge. And I'm sure it takes time. I'm curious, Joanna, did it take you some time to feel, obviously, you were learning medical jargon in another language. How long do you feel like it took till you felt like you could really show up and confidently speak with the medical professionals and feel like they were, really coming to you and trusting in you?
In the setting that I'm at, it took I'd say about 6 months. I made sure that I bumped into them during lunch breaks and at little meetings, had conversations. I would also approach them and talk to them about certain patients that maybe needed a little extra attention. And so when they noticed that I was paying close attention and really taking care of it, and a lot of providers, I know my providers with our clinics, they do like to ask their patients, what did you think of the therapist? Did you like her? And so to make sure that we get reviewed by patients as well. So that's, yeah.
Great. That's great to hear. 6 months. To me, that shows that you had a very supportive community. 6 months isn't that long. I expected I felt confident after a few years, but good for you. That's really good to hear, especially knowing that your degree is setting you up for success. Your program is setting you up for success. And that, I think it is also helpful for students to hear, it's helpful to show an investment in the people you're working with so that you can work collaboratively. You all have the same goal in a sense. So I think it's really great that you took some initiative and were building those relationships with the people that, really you need them and they need you. So I think that's really cool to hear about. So thanks for sharing. All right, Amberly, let's hear a little bit from you about what's one piece of advice you would give a student who's thinking about pursuing this field. I know you work with current students in their practicums and things like that, so it'd be really great to hear what your advice would be.
Well, I couldn't think of one until you said it could have been something I've been given. And it was one of the professors at BU, and it's actually the opposite of what I went the other way. They told me, we heard it a few times, don't take whatever job you get right out of school. And I am a stubborn human being and did not want to do that. And went on multiple interviews after graduation, and none of them felt right, even though I got offers, but they just didn't feel right. And that's not what I wanted to do. So that haunted me in my head. Like, I need to just take the job because I'm being offered it, just do it. But I didn't. And I ended up getting the job that I wanted, being an outpatient therapist. So my advice is actually more related to your, like, once you graduate, don't settle. Like, you can push for what you want and what you want to do. Otherwise, it's not going to be a good experience, and you're not going to get out of it what you can get out of it if you love doing it. So that's my advice.
Thank you, Amberly. Such good advice. I mean, from a career perspective, we try and tell students that as well all the time, to really know your worth, know your value add, know that there are opportunities out there for you that will fit within your skills, but also your values. Like, I appreciate what you said about, just you didn't feel like those first opportunities were a good fit. And I think that's a very real thing to pay attention to when you're a new student. You don't work this hard and honestly spend this much money and to just take the first job that's given to you. I think it's good to explore and see where you could really take your skills. So I think that's some really great advice. Great for our students to hear. So thanks for sharing that. And then let's go back to Robert. If you could share what was some good advice either you received or advice you would give a student who's maybe thinking about, since you've had this experience in the hospital setting and in that fast-paced environment, what advice would you give to a student who's like thinking about that or isn't sure? Love to hear from your perspective.
Yeah, so I mean, I think the obvious one is don't be afraid to ask. If you don't know things, it's a crazy, especially medical, social work, really anything though, it's okay to ask, especially, when you're not sure. I think don't feel bad about it, because I used to have reservations of asking some things that I probably should have, and it took me a while to be comfortable enough to say it's okay to ask. It doesn't mean you're a bad social worker at all. Have boundaries. Oh my God, have boundaries. I mean, that's for every social work. I don't care what you're doing, that one is huge. And that one, especially just to help you from getting burnt out, know your boundaries and know, what you're expected to do. There's nothing wrong with having those. Let's see. I guess, if a student wants to go to work in an inpatient hospital setting, I think in my experience, it was probably, beneficial. Sometimes it's hard to break into that, I found. I got very lucky with getting an internship. I did a 2-year, I didn't do the advanced one. So my first internship was at DaVita Dialysis. So I worked at a dialysis center. I convinced somehow some poor social work dialysis worker to do, supervise me that first year. And then that's how I got a job at an actual hospital for my second year of my MSW. But if you're not able to kind of break into that, or you don't have that experience, I think there's other things that will look good on your resume that can help you kind of break through. Just off the top of my head, like a hospice, a skilled nursing facility, an acute rehab, home health, any of those things are very intertwined with inpatient hospital care, and they all need social workers. So I think that if you need that extra experience, or maybe you just want a taste of it, that's a good, I think, place to try in my personal experience.
Excellent. Thank you so much for giving that advice and some other recommended pathways into the medical arena. I think for social workers is really helpful. And I really appreciate, Robert, that you are continuing to sort of emphasize this idea of staying curious, asking questions, not being afraid to mention, or to say that you don't know early on in your career. It sounds like for you, you were asking a lot of questions about the medical side of things when you were in your role, and not being afraid to do that. And especially not being afraid to ask questions even now as students, taking these opportunities to reach out to your, practicum supervisor or other alumni that, really do want to connect with you and want to help you find the place that's right for you. So not being afraid to, to bother people, I think is a misconception as well. Like you're bothering these people who are professionals, but in reality, these panelists, and there were many others that were happy to share their experiences and provide guidance to new students and new professionals. And they're out there, and it just requires asking questions. And then, of course, the boundaries piece is huge, and I'm sure most folks can relate to that. And as you go into your profession as a social worker, making sure you know what those are. I really appreciated that, Robert, too, is like knowing what your job is and where the line is, and making sure to take care of yourself in the process. So yeah, thank you for that. All right, Tim, we'll go to you. Any advice that you would share with students that might be pursuing these areas?
So I think a really big thing for me is this piece of acceptance of when I work with clients. I have a lot of clients that might be like quote unquote success stories. And there are also clients that you may not see a whole lot of success working with them for whatever reason, whether they just don't engage, if they drop off at a treatment before you feel like they've completed it. Some of my clients have passed away while I was working with them. All these different things, and so just understanding of what do I have control over as a therapist and as a social worker. When my client is in the room with me, I can be present with them and I can do whatever I can in that moment, or when they're my client, to be there for them and to support them. And if it doesn't happen, or if it doesn't go the way that I would have hoped it would, then I was still there and present. I had this tradition where whenever I get in my car to go home, I take up my lanyard and I put it on my rearview mirror, and that's kind of my way of saying I'm done for the day. And those are, I'm leaving all my work stresses there. I can go home and be present with my family. And so that acceptance piece has been helpful for me, and I think is important for social workers to really work on as they come into the field.
Yeah. Thank you for sharing that, Tim. I think that's so real. Especially, hearing all of you talk, that I think with medical social worker comes a lot of, I would imagine challenging realities of people's, people passing away and having to deal with, significant illnesses that may not have a cure, or, and I think that's a lot to have on your shoulders as a social worker. And, I would imagine requires a lot of, like what Robert said, boundary setting, but also knowing what you can control, knowing what you can do, and hoping that, everything you've done that day was enough. And that's, but that's a lot to have and to witness and be a part of. So I think that's helpful for our students to hear, is that there may be some challenging days like that. And how do you really take care of yourself in that environment? So I appreciate that perspective immensely. All right, well, great. Yeah, so those are the main questions that I had for our panelists. And we actually have had a couple of questions come up in the chat as you all were talking. And so Elizabeth, I don't know if since you've been managing that or watching that, if there's been any specific questions that we want to make sure to get to that you saw.
Yeah, there's a few, and I was waiting for the right moment. Let's see here. Just want to make sure I don't skip any. So, one question from Tiffany was, do you spend much time working with clients' families, or is it just mostly focused with the client themselves?
That's helpful. I think that question may have come up, Tim, when you were talking, because I know you were talking about a lot of the one-on-one patient care you were giving, and I think it came up when you were chatting. But of course, feel free to answer from the others as well.
Yeah, so I work with clients' families quite often, and that's just a huge piece of their lives that, for better or for worse, has a big influence on them. And I don't necessarily do like family therapy per se, but if I if I have a client that is 17 years old and I give him some homework, it's really helpful for me, for his mom to know about that and to know like where we're going, what direction that is, with different things we're working on. And so I've kind of developed a sense of when I meet a client and I have some interaction with their families, what families might be really supportive and helpful. And when that happens, I get really greedy with that because that can be so helpful. And unfortunately, some of my clients don't have very supportive families. And to be quite honest, their families might be kind of a big part of the issue. And so in those situations, I try to work with the client and with that. But yeah, any chance I get when there's a family involved and if they're supportive, I love to get greedy with that and involve them in the treatment process.
Thank you. Robert, I'm curious, in like the inpatient medical social, like the medical environment, were you working with families quite a bit, or was it because it was such a fast-paced environment, there maybe wasn't as much time for family engagement?
Yeah, it's almost always with families. So sometimes you would have to wait. So, I guess one thing I forgot to say for advice: if you do work with them, be friends with the nurses. The nurses are the people you want to be friends with. Be nice to them, buy them donuts and everything else. But yeah, sometimes you'd have to wait for families to come in. So you would be including the nurse, like, tell me when this patient's family's in so we can talk. There's a lot of like, end of life things, on that spectrum. Are you going to go to hospice? Are you not? These are all big family decisions. Who's going to take care of this, patient? Sometimes it's a roll of the dice. Sometimes, a patient's family is very supportive. We'll have grandpa can come to our house and, while he needs physical therapy and while he's still weak, recovering, we'll take care of him. And then other families are like, I don't want to take care of grandpa. We don't have any money, so we don't want to deal with this. So families are very, very kind of what Tim said. They can be good and bad, but definitely, you work with them a lot.
Great. Thank you both, Tim and Robert, for sharing those perspectives. Was there other chat questions we could get to?
Yeah, so another one from Leah was, if you don't get your LCSW, what are some jobs that a medical MSW, so without the L, could do?
Yeah, I know, Joanna, you are in process of getting your L. You mentioned your LCSW. Were there other roles you considered prior to pursuing the role you're in now, or you've been in other roles before this point that would align with this question?
Honestly, no.
It's okay.
I've been with the same clinic since I graduated.
Which is great as well. I mean, ideal, I would imagine. It sounds like you're very supported at this place. So.
Oh, yeah. Great team. Yeah.
Awesome. And congrats on getting the L. soon. Anyone else open to sharing to help with this student's question?
I believe so. Within Intermountain, we also have case managers, care managers, and they don't often do full clinical evaluations. They're doing a lot of resource giving and helping getting patients health appointments or whatever they need upon discharge. And I believe that's a different avenue that you can take with your MSW. Don't throw my name that I said that, but I'm almost certain that you can go that direction with that.
Excellent. Thank you, Amberly, for providing that.
There were some additional questions. One was it difficult to find employment in a desired field once you received your degree? So I know that some of you had different pathways to get to where you are now, but do you perceive finding a job as difficult, especially in your desired field or in medical social work?
I'll speak again, sorry.
No, that's great. Thank you, Amberly.
Yeah, of course. So I think the challenge for me when getting onto into the U or into Intermountain, and it's sad to say, but it's all about who you know. Because it's a matter, they get so many applications, and knowing somebody, they can reach out to their recruiter and say, hey, we're looking for this one or so and so. So if you know anybody who works in those systems or anything like that, reach out to them and have them kind of help you navigate it. And
Perfect. Thanks, Amberly. That's super helpful. I would say, connecting with people, especially when you're a student in the College of Social Work, there are so many connections available to you, whether it's through faculty or events like this or your practicum, really making sure to take advantage of those opportunities to get connected to the right people who've either been practitioners in those fields before or are still now. And also, I know this sounds funny, but most of the panelists I think that I've connected with today, I found them through LinkedIn, and LinkedIn is a really powerful tool to find those individuals who are in the field, the specific area within medical social work. I saw someone in the chat had asked about working with children at like primary children's and how do you become a social worker like that. There were several alumni in LinkedIn from, graduates of the College of Social Work who are doing that work right now. I reached out to them. They weren't available. So, but they're there. And when they put themselves into LinkedIn, that shows you that they want to connect. And so if you ever want support with that, me as a career coach or myself or Kathy, my colleague, are here to help support you in making those connections so that you can feel confident going into the field that you really want to pursue.
Speaking of working in a children's hospital, and then we'll go back up and there's a question about palliative care as well. But as far as being on the topic of children's hospitals, Amanda wanted to know, hey, if I want to work in a children's hospital setting, what kind of responsibilities would that entail? If anyone can maybe speak to that a little bit, if you have knowledge about that.
Unfortunately, Mayo didn't have, there was no children. The only thing that involved children was our radiation, cancer radiation, like the proton beam and that type of thing. But aside from that, unfortunately, we didn't have children, in the hospital. Phoenix Children's Center down here in Phoenix, I do have a couple colleagues that's worked there and people I went to my MSW, and they, they loved it, but it's from, I only can speak from what they said, but I think it's relatively, very family heavy and going through what some of these kids have to go through with cancer and all of that is, it's very hard. So, I would say if you want to do it, I'm sure that, having that medical experience and also having a passion, obviously, to work with kids and such a difficult time. Yeah, but unfortunately, I wish I could speak on that a little bit more, but we didn't have kids where I worked in inpatient hospital.
I have worked, I did PRN for primary children for about a year. And I did the inpatient side and crisis for them. And it's a totally different ballgame and I went into it thinking I love kids. I get to work with kids, and you don't get as much of that interaction as you think you would. You're doing a lot of family, a lot of getting families connected to resources and setting them up for when the child discharges and getting things arranged to meet their medical needs. So it's heavily influenced by family work. And then on the crisis side, it's again a different ballgame with kiddos, because you're dealing with two very different stories. You're dealing with the child's story of the situation and a parent's side of the situation. And it's rare that they are the same. And what the rule of thumb for us when I work there is you always take the worst case scenario and go off of that. But it's a lot more time consuming, meeting with families one-on-one and kids one-on-one. But I love the crisis side of it. That's kind of where my heart lands, but it's definitely a different ballgame than adults for sure.
Thank you. Thanks, Amberly, for providing that insight as well.
We had another question earlier, and it was about palliative care. So the question was, do you see a lot of palliative care in hospitals, or is that more done in private practice?
Yeah, I think I can answer a little bit of that. So palliative care and hospital care, kind of the comfort care part, it went hand in hand. So, in my experience, it was essentially if the patient was towards end of life, pretty immediate, then, the physicians first would talk about hospice and palliative care and the differences and all that. And then I would come in and help give the patient's family a choice. So I would kind of help them wrap their hand around all of this. Their doctors are coming in all day. They're all a mess, understandably. And but so we would give, specifically just for hospice, we would give them choices, and then the private hospice company that they want to go with, I would work with them and the family together as kind of a liaison. For palliative and kind of pain management, we had our own team there, but I also served as, I would be a de facto palliative social worker. But yeah, we definitely did a lot of that stuff. A lot of pain management, a lot of comfort care, and a lot of accepting, this is my 4th time in the hospital. My cancer, the doctors are telling me now my cancer is, the prognosis is very poor. What does that look like? And what does that look like for my family? What does that look like for all that? So it's a very heavy piece, but it's a very, a much needed one. And I did do that a lot. And I think I would assume most inpatient hospitals do work with that. But you can also have, like I said before, some palliative care and hospice type of places, they all have their own social workers there. So you can, if you want to just only work with that, you can do that.
Excellent. Thank you so much, Robert, for sharing that. So we are at 6:02 for our event, and I want to be respectful of our panelists' time, but I do want to say thank you to Joanna, Robert, Tim, Amberly, for providing all of your different perspectives, letting us know kind of how you came to this area, where you're at now, how you're taking care of yourselves, how you're setting boundaries within your roles. I know this has been super enlightening for me, and thank you for being so open to share the realities and the rewards of your jobs. And I just also want to say to the attendees, please don't hesitate to reach out to me as a career coach or my colleague Kathy if you need support or you're trying to explore these areas of social work in more depth or connect to alumni like our panelists in these specific areas. We are here to do that. It is really something we are excited to do. Elizabeth put our website in the chat so that you can easily make an appointment with either Kathy or myself, depending on if you're a graduate student or an undergrad. So again, thank you so much. Thanks, Elizabeth, for your support and managing the chat. And I hope everyone stays safe out there. Have a good evening. And yeah, we'll talk soon. Thank you again to our panelists.
Thank you.
Okay.
Thank you.
Bye-bye.